When you get up in the morning, this is going to be what you are going to do. I'm going to give you a series of movements and we are going to go through them from sitting all the way up to standing. The first movement is going to be your leg raise, bend the knee as far as you can, straighten and drop. Now you can also keep the leg up, straighten, drop, straighten and drop. Your choice. And then down. Leg up, bend the knee as far as you can. If you feel the need, put the hand on the back right around that area. The reason why that works so well is because these muscles lock and unlock the knee. There is a tiny one under there that locks and unlocks the knee when you straighten it. We will be working on this. We're going to do at least 5 reps of each one. If you want to progress up to 10 reps, you are welcome to. The next one is going to be hip rotations. I would recommend that you start with your knees up like this. We're going to drop them over to the side. Go as far as you feel comfortable. We're going to do at least a few on each side. I would say at least 5. And we can do this together as you watch this video. Breathing as you go through. When those get easy, we can bring the feet up and let the knees drop. Deep breath in. Let it out as you go down. Notice that side for me is a little bit difficult. Okay, and then come back up. With the knees up like this, we're going to progress it all the way through. We're going to pop the knee over as long as it's comfortable for you. If it's not comfortable for you, then feel free to just hold the knee like this. We're going to do foot circles. All the way around, clockwise motion. Sorry, I just messed it up there. And then back around the opposite direction. 5 each. Feel free to go as slow as you need, noticing where this part of the knee rotates. And then back the other way. I feel a little tight about right here, so I'm going to concentrate on that. Then what we're going to do is take the left hand, push against the left knee. And then you can bring it up close to you. Push against the left knee, push the knee up towards you, and relax. Push the knee up towards you, deep breath, and relax. And then what I'm doing is I'm pushing my knee down towards the foot of the bed. Okay? Other leg. Pop the ankle over. One side may be tighter than the other one. Knee circle, or foot circles. Concentrating on the movement. You can even put your hands on that little bony knob right underneath your kneecap. And 5, back the other direction. See, I feel like I have a little bit more control on this right foot. Sorry, right foot. And probably 6. Now we're going to push down. So you're pushing your knee this direction with your hand. And I'm going to push my knee towards my face and hold, deep breath, all the way out and relax. Push the knee down a little bit more and push back up towards your face. Hold, deep breath in, let the breath out, push the knee down. Excellent. That's it for the lying exercises. I'm going to show you one more exercise. If you are so inclined and if the low back feels a little bit tight, you can bring the knee up as much as you want, then drop the leg over. If you want to deepen this stretch, look towards the opposite side of your leg. And breathe. And breathe. Bring it back and down. Knee up and over. This side's a little worse for me. So you can kind of rest your knee on your hand. My knee doesn't touch the ground. On this side, I'm going to look this direction and I'm going to breathe. And all the way out. Now, on the side that's tight, I like to drop my knee and bring it back. Drop my knee and bring it back. Drop my knee and bring it back. And then drop and hold. Notice how I was able to get a little bit further. My back loosened up a little bit more there. It's not as tight. Mobility before stretching is actually my preference in that case. So now I'm going to show you the seated exercises. When you raise up in bed, you turn off to the side. On whichever side you are on, we're going to do 1 or 2 exercises on the side of the bed. When you get into a comfortable seated position on the side of the bed, we are going to work on some toe exercises. Then I'm going to show you a bonus exercise that you can do for your low back that is also called the pelvic tuck, that is in the pelvic tuck video, as well as typically on day 1 of clinic with my patients with low back pain or foot pain or knee pain or hip pain sometimes. So what we're going to do with the toe exercises is we're going to sit on the edge of the bed and put our feet flat on the ground. If you have socks on, please remove those. What we're going to do is sit comfortably, and if your fingers want to move, allow them to move. If your toes are moving on the opposite foot, allow your toes to move on the opposite foot. We're going to perform this together. So we're going to raise the great toe and drop it down. Raise the great toe and drop it down. Now, if your toes all move together, then what I encourage you to do is raise all of the toes, drop them down. Raise all of the toes, drop them down. As we progress, then you're going to raise the great toe, toes, drop them down, then raise the other toes, drop them down. Great toes, other toes, great toes, other toes. We're going to perform those for 5 to 10 repetitions for both feet. You can do them one at a time if you choose and want to isolate it just a little bit more. The next exercise we're going to do is standing. Then when we are ready to stand up, we are going to stand up. So the next exercise, you're going to put the feet almost together. And what we are going to do is, keeping the feet on the ground, we're going to do a standing rotation. My ankle just popped on my left-hand side of the foot. What I want you to notice is we are going to keep the knuckles of the feet on the ground. So if the foot wants to come up like this, or if the knee is trying to bend, try to keep them straight. For my knee pain patients, do not lock this knee out here like this. That may cause just a little bit more irritation. And we're going to breathe and then come back to center. With the rotation, we're getting spinal rotation, hip rotation, rotation at the knee, as well as foot pronation and supination, or foot movement. Notice how that foot wants to come up just a little bit. I'm going to exaggerate that. Put that foot back on the ground and breathe. And then come back to center. Rotate, pushing the foot down and back to center. Rotate, pushing the feet down and then back to center.